Looks like we can go ahead and get started now. So I want to welcome everybody to the SADS Foundation Pregnancy, the Patient Perspectives webinar. Thank you for joining us tonight. I'm Genevieve Eccles, and I'm the Family Support Director for the SADS Foundation. And we are super excited to have our three guests here tonight. We have Tia Hansen, Mary C., and Maudie Kirkpatrick. Sorry, Maudie, I almost butchered your name there. And they are going to be sharing with us about their pregnancy journeys with a SADS condition. And then following our discussion, we will take any questions that you might have, and you can post them in the chat anytime now during our discussion. So now I'm going to introduce our panelists. We have Tia. Tia lives in Utah. She has 4 kids. She's part of our SADS staff, and she is amazing. We love working with her. And she has long QT syndrome. She is passionate about anything cardiology related. She loves traveling to Hawaii and doing bike rides with her family. Our next panelist is Maudie, and Maudie was diagnosed with ARVC back in 2006 as a teen, and she gave birth to her daughter in 2021. She overcame the challenges of her disease to achieve her dream of motherhood, and now spends her days chasing her toddler around. And our next panelist is Mary C., and she is a proofreader for a textbook company in the Florida Panhandle, and she has CPVT. She is an avid reader, and also enjoys baking, thrifting, and Taylor Swift. Thank you to each of you for participating in this webinar and being willing to share your stories tonight. So we'll go ahead and get started with our discussion. So I'm going to first ask each one of you to tell me a little bit about your SADS diagnosis and how you ended up getting diagnosed. Tia, would you want to start us off on that?
Yeah, no problem. Hi, everybody. Thanks for joining. I was diagnosed with long QT type 2 when I was just 12 years old. My aunt was one of the first to have it discovered in Utah and in our family. I've been asymptomatic, knock on wood, and that is why I knew that I had it, just because of family. And I've just been tested since then and genetic tested and see a wonderful cardiologist yearly now. So, and take meds, and that's how I was diagnosed. Thank goodness. Not through a heart event, which I know many people have dealt with.
Thank you so much, Tia, for sharing that. Maudie, would you mind going next and letting us know how you got your diagnosis?
Sure, thank you. My name is Maudie, and I was diagnosed with ARVD/C. I know it's been changed since I was diagnosed in 2006. My father had been finally diagnosed after about 15 years of being treated for VT. After a failed ablation, they discovered it was ARVC. And then I went through testing and was diagnosed 3 months later and received my ICD. And I've been symptomatic, shocked, on the meds, done all the things.
Thank you, Maudie. How about you, Mary?
Well, I have 3 sisters who also have CPVT, and my mother as well. We've all gotten genetically tested. It kind of started way back when all of us girls were like entering puberty. We would start passing out, and we had events of syncope, and a couple times it happened in a pool. One of my sisters had to have CPR done, but through all of these events, we still never saw a cardiologist for it. Like, it was never brought up that that's where we should, be looking. It was all neurological and things like that. When I was about 18 or 19, I did go see a cardiologist, and he misdiagnosed me with vasovagal. And so it wasn't even until years down the road when my youngest sister had a car accident. She passed out behind the car when they pulled her out. She was not breathing. She didn't have a pulse. They did CPR and shocked her and got her back. She spent about a week in the ICU. And then they put a pacemaker in later and started the testing. And that's when it came back that it was CPVT. So it's all of my sisters, my mom, and then I also have 3 out of my 4 children are positive.
Thank you, Mary, for sharing that. So each of you were diagnosed with your SADS condition before you went through pregnancies. And so that's okay, that's right. Thank you, Mary.
I had 1 pregnancy prior to diagnosis.
Thank you. So then I guess that brings me to my next question. And Mary, maybe you want to start out with that. So you said that you've had 1 pregnancy before your diagnosis. And maybe you could kind of tell us what your pregnancies were like, if they were different or if they were the same, and plans that your doctor made for delivery that may have been different.
Yeah, all of my pregnancies were super unusual. I didn't have to ever see a high risk doctor. I did talk to my OB before during every pregnancy. Do I need to see a high risk? This is my condition. These are the meds I'm on. So my first one, obviously, I didn't know that I had it. So it was a completely uneventful pregnancy. My second one, I was on medication, but I did not have my ICD yet. And then my third and my fourth, I had my ICD implanted. So yeah, they were very uneventful. I didn't ever have to see a high risk doctor. They offered me that choice, but I never had any events. After I got on my meds, I've never had an event. So my pregnancy didn't really change anything with that aspect. So my first pregnancy ended in an emergency C-section for causes completely unrelated to my heart. So I was overdue. She had a body cord. Her decels during labor, and so it was an emergency C-section. My second one, I really wanted a VBAC, which is a vaginal birth after C-section, and so I was able to get with a doctor that had like he looked at the risks and the factors that went into it, and he's like, I think it's safe for you to try this. Um, being on your meds and all of that, being completely healthy, a perfectly normal pregnancy. So we went all the way until 40 weeks. I did not want to go overdue again. That caused some crazy stuff in labor. So I was like, I want to get induced. So he allowed me to get induced. And it was during induction that I found out she did not have any fluid. I hadn't had a ultrasound in 3rd trimester. It was just something the clinic didn't do. They did the 1st trimester in the 20-week, but they just didn't do one. So I found out it was a dry birth. It ended well. She came out. She was perfectly healthy. She's actually the one that doesn't have CPVT. And I got my VBAC. So I was very, very happy with that. And then my 3rd pregnancy, I said, hey, I really want to watch this. I want to watch the fluid levels this time, because I kind of had a suspicion that it was due to my meds, but there was nothing to back that up. I was just like, let's watch the fluid. So we did. And at 39 weeks, the fluid was gone again. And we had kind of an emergency induction. There was nothing really rushed about it. I just went into induction that day. And he was perfectly normal, very healthy. I had another vaginal delivery. And so my 4th one, I was like, okay, we're gonna do the same thing. Just keep watching the fluid. And his fluid levels were low, but they were not too low to induce. And he came at 38 weeks. Once again, a vaginal delivery, no complications, very healthy babies.
That's amazing, Mary. That's great to hear about all the successes you've had with your pregnancies and all the healthy babies. Thank you.
Mhm.
Tia, so all of your pregnancies have been after you were already diagnosed with your long QT. And will you share a little bit about how many pregnancies you've had and what your pregnancies were like?
Yeah. So pregnancy, I'm not a huge fan of it. I know everyone has their own experience. It was rough for me. I was so sick. And with most of our heart conditions, electrolytes are so important. And so I had to go do IV therapy because I was so sick and just vomiting nonstop with all 4 pregnancies. And so there I was doing that and just miserable. It was always a long pregnancy. So grateful that I was able to get pregnant. Um, and then my first, he was measuring really small, and so he had intrauterine growth restriction, and so he was induced at 37 weeks. And I was planning on doing a regular delivery, and then he had some issues as well. His heart rate would drop, and the D cells as well. And so we decided C-section was the best, safest option for me and for him. He had to stay in the NICU for a little while, and they wanted to wait for him to get a little bit older to test him for long QT. Because his blood sugar was so low and abnormal. He had some abnormalities just with being in the NICU as it was. So we waited for him to be about a month old. And then we went up to our local children's hospital we did test him. We did test him for long QT and he was positive. We just didn't want to start him on meds until we could get him totally back with his blood sugar and get him admitted to start him and monitor him. He is now almost 10 and has been awesome and has done so well with meds. My second, she was my biggest baby. She was 6 pounds, 3 ounces, and she was the only one that came at the right time. And the one she didn't have to go to the NICU or anything, and she's thriving and is positive as well. All 4 of my children tested positive. It's crazy how the genetics work, isn't it? Everybody like 50-50. Sometimes you're like, how is this working? So yeah, they all ended up being C-sections just because we just thought that was the safest, best route. And that's what I had done. So I was okay just to keep moving forward with that. With my last child, we did go to maternal fetal medicine because she had a few red flags. And she stayed in the NICU for a little bit as well. One of the biggest things that with long QT, with type 2, we're most at risk postpartum because of all the hormones, right? And lack of sleep and all of that. So when I first delivered my first child, one of the physicians, not my immediate OB, but another one, she was really worried about me and put me in the cardiac unit, which I was just like, wait a minute. I had my baby early. I had a C-section and I'm in the cardiac unit, and it was just, didn't go the way you hope, and it was kind of rough, just a lot of, unknowns and things I didn't expect. And because of that, my wonderful OB got labor and delivery to have a telemetry room. And I'm sure many women have benefited from it, as well as myself. And I was so grateful because of that unfortunate experience. It did have a good outcome. We were able to help enforce getting that telemetry in a labor and delivery room. So I could be in labor and delivery and not often, or not labor delivery, but mother baby. And I was able to be there rather than the cardiac unit. So good things do come from hard things. You learn each time for sure.
Thank you so much, Tia, for sharing your story.
Mhm.
I think Madi, would you like to share your experience?
Yes, it was really great to hear everyone else's experience, that y'all went through so many great, wonderful pregnancies. My pregnancy journey was an interesting time. I was already in heart failure along with having ARVC. So I was high risk. I took about a year to get off of medications for heart failure that would interfere with pregnancy. And then I was cleared, and my heart failure doctor advised that he would do his best to keep me alive, but I was taking on a big risk. So I was pleasantly surprised and terrified when I became pregnant. I like I said, had already been referred to high risk before pregnancy. I was seeing one high risk doctor, maternal medicine. He told me I was too high risk for her, and I had to see a different one in Dallas. So I thought that was funny. And I had a lot of close monitoring. I had ultrasounds every month. Starting at 3 months of pregnancy, I had to get lab work every 3 times a week to monitor potassium levels, because there's so much fluid shift during pregnancy. And since I was in heart failure, that negatively impacted me. I was basically on bed rest starting around 4.5 months. I just couldn't do anything. My body physically was just growing a baby, and that's all I could do.
Yeah.
So it was a very interesting time of my life. After I was getting closer, they kept telling me I was clear to have a vaginal birth, and I kept saying, I think I need a C-section, and they're like, no, you don't. And I just happened to have an appointment with one of my cardiologists, because I had 3 heart doctors, 2 EPs, and a heart failure doctor. And one of them was like, he's like, what's your plan? I was like, they're going to have me deliver, I think maybe induction. And he said, no, he's like, you can't even walk. He's like, why would they want you to have a vaginal birth? Like that's detrimental. So he sent a very strongly worded letter from what I heard from him and then the receiving doctor. So they quickly changed their plan within a matter of a week. And I was scheduled for a C-section. So this all started on like a Monday, and I was scheduled for C-section the following Monday at 37 weeks. And I went into spontaneous labor that Friday and ended up having to have an emergency C-section, which was a very overwhelming looking back. I'm just really grateful they had a plan in place, because I think if they didn't have a plan, it would have been a lot different outcome. I was on blood thinners. I had developed blood clots during the pregnancy. I was hospitalized a few times due to fluid, and then I developed blood clots. And I was on a blood thinner that couldn't be reversed. So they had to prep me and then knock me out as soon as they were going to cut. So it was a very chaotic experience. And from the time I arrived at the hospital, I was back in surgery in like 45 minutes. So everything happened really fast. And the anesthesiologist, because we was at a university hospital, I thought it was interesting. He was like the only anesthesiologist apparently, and like one of the few in the country that specialized in fetal medicine and cardiac conditions. And so like he was like the perfect guy. And it was the one day he was at the hospital every 8 weeks, just happened to fall when I went into spontaneous labor. So I feel like God really had a plan for me and brought her here safely. She was born a little bit premature. She was 4 pounds, 13 ounces, and she was in the NICU. So I had to be sedated. So when I woke up, I also had to go to cardiac ICU. And there was no option for me to see her for over a day, because they had to transfer me out of cardiac ICU. And then with her being in NICU, I had to get to my room, and then someone could finally take me to the NICU. So it was not how I thought it was going to go. I thought I was going to have a scheduled C-section and get to see her be, delivered and all those fun things, bonding, the skin to skin. And I didn't get those experiences. We spent 10 days in the NICU and recovering from a C-section and heart failure, and then having to try to get up and down. There was still COVID policy, so I couldn't have anyone with me. So me and my husband were swapping every 12 hours. So it was a really rough beginning from me after I was discharged from the hospital, but we were very lucky. Everything went well, and she, started gaining weight. She was pretty small. She wasn't on the growth chart for about 6 months, but she did finally start gaining weight and she got stronger, and now she's 2.5 and she's completely healthy. So I didn't want to test her genetically, but my family felt differently. Our family, there's like 7 of us that have ARVC. So I lost that argument, and she did end up testing positive. So it's just been, it was a fun time, but it did end up 18 months later being admitted for heart transplant. But it's to be expected because I was already in advanced heart failure when I chose to go through pregnancy. But I would have done it again. She's the best thing that ever happened to me.
Thank you so much for sharing that, Maddie. I'm glad that both you and her are doing well now. I can definitely see why in your introduction you included the chasing around the toddler part. So congratulations.
Thank you.
So did any of you experience cardiac events during, like Maddie, you talked about the heart failure and things like that during pregnancy. Tia or Mary, did you experience any cardiac events during pregnancy at all?
Did not.
No. Great.
Just closely monitored.
Thanks, Tia. During your pregnancy, Maddie, you talked about the additional monitoring that you received. And I think, Tia, you talked about the needing the fluids and things. Mary, did you have to go through any additional monitoring with your CPVT during pregnancy?
I had the option, but since I wasn't having any episodes, I just chose to stick with my normal cardiology appointments, every 6 months, every year, and then my regular OB.
Perfect. Thank you, Mary. And we talked about the maternal fetal medicine doctors and when they were warranted and brought into your care for both Tia and for Maddie. And I think that that's something that's really important to bring out. And a lot of times we get this question from SADS about whether, I have a SADS condition and I'm pregnant. Do I need that additional monitoring? Do I need to go through a maternal fetal medicine doctor? And so many times, as you guys have shown, that's not necessary. And so I'm glad that you were able to experience the joy of just having the pregnancies with a regular OB and not have to be concerned about the additional monitoring. So, but I think, like you said, Maddie, in your case, it's so important to have that dialogue with your doctors about whether you need that monitoring to be safe or through your delivery, and really advocating for yourself. Maddie, I loved how you talked about advocating for yourself. So for other moms with SADS conditions that are pregnant right now or that are thinking about becoming pregnant in the future, what would you recommend to them to help them advocate for themselves and get the care that they need? If any of you can start first. Maddie, do you want to go first?
Sure. I was told not to have children since I was 17. So having to advocate for myself to even get someone to agree that we could go through pregnancy together took a lot of time, and finding the right team of doctors. I have a cousin who also went through pregnancy, but she didn't have heart failure, but we share the same disease. And she was also referred to high-risk fetal medicine just because with ARVCs specifically, I can't speak to the other diseases, but you can just start having an arrhythmia out of nowhere, and stress, and pregnancy is a lot of stress, that you can just flare and have an arrhythmia out of nowhere. I had a couple of arrhythmias, but I never got shocked by my ICD. My device treated it. So I do think it's really important to communicate with your doctor that it's a desire you have, and to make sure you advocate until you find a doctor willing to work with you, because it is possible. And if I would have had different information, I would have probably had children before I was 30 in advanced heart failure. So I think it's amazing what modern medicine can do. But there is a lot of medications that do interact with pregnancy, and it's important to not, I think, go in unplanned just because you wouldn't want to harm the baby. And sometimes even your doctors aren't well versed in that effect. I was on medication, Sotalol, and I was told that it would save my entire pregnancy. I mean, I verified with multiple doctors, and then after I delivered, they were informed me that Sotalol was not safe for pregnancy, and I could not breastfeed with it. So that was a pretty big blow for me because I was very upset because, like I said, I had a lot of monitoring and care for 9 months, and it wasn't until she was delivered, and then I also found out that could have contributed to her growth restriction because she was very small for 36 weeks. So it's just important that not only advocating and speaking to the doctor, but doing your own research. If I would have researched my medicines, I would have found that out myself, and we could have made the switch earlier on before it was after delivery.
That's a great point, Madi, about doing your own research and making sure that you're well versed in what you want in your plan, and then bringing that to your doctors. And I think that we have a great community here that we can talk to and bounce things off of. And so I love that, the fact that we have all of these moms on today, that you guys are learning from each other and can support each other. So thank you, Madi, for sharing that. Tia, would you like to add something?
Yeah, I mean, what you said was perfect. But I agree, just what we have talked about with being your best advocate for yourself and your child. Just like you said, just know about things ahead of time, like, because our conditions, there's nurses that, are unfamiliar with it still, and even some physicians aren't as well trained as others, obviously. And I think just being aware ahead of time of what's best, look at all your options, and just have a good open communication with your care team, whether there's a specialist involved or it's your OB or your regular cardiologist. Try to all get on the same page. And that was something that I did with my last 2 pregnancies. And I was so grateful that my cardiologist and my OB were interacting, and that just made me feel so good. I just thought that was so great that we could all agree and just talk about everything. And second, if your child does get tested positive, I know it's scary and a lot of uncertainty along the way, and yeah, a lot of unknown. Hang in there. It's it's a lot sometimes, and with pregnancy and delivery, it's not always what you hope it's going to be. And I'm not telling you that you have to be positive, because it's hard, and especially if things don't go according to how you would hope or planned. Just hang in there and just take care of you and your child. Do what you should be doing to keep each other healthy, and just get tested, and just get your child into a specialist. And I just have to say, my children have done amazing on beta blockers, and I feel like starting at babies, because like I said, my oldest, he started when he was about a month old, but my others were immediately, and they have done so good. I feel like the younger they are, they tend to just do really well. And just have a good open communication with your care team, and just be your best advocate.
That's great, Tia. Thank you. Mary, would you like to add to it?
I was just going to say kind of what they already said. Do your own research, be your own advocate. I had my ICD implanted when my second child was 4 months old. So I got the diagnosis, and then my cardiologist in town really wanted me to get the ICD. We got a second opinion, actually a third opinion, from the Mayo Clinic, and one said yes and one said no. Because with CPVT, it can cause an electrical storm. And so there's a lot of people on both sides, risk factors. And so I waited a while before I decided yeah, I'm going to do this. And so she ended up being 4 months old. And I didn't have anyone to ask. I couldn't find any information about breastfeeding and having a surgery, because it's being put right there in that tissue and in that fat layer. And so I ended up finding this one lady on a forum. She had had an ICD for something unrelated to SADS, but she said that she was able to continue breastfeeding afterwards, and that she weaned from the one side before the surgery. And so I was like, well, that's interesting. I didn't end up doing that. I just kind of went into the surgery and, like, whatever happens, happens. If I don't end up being able to breastfeed afterwards, then so be it. But it ended up I ended up being able to continue and breastfed her until she was a year old, and everything went really well. I did have to stop feeding her for like the 24 hours, with the medicine and everything. But yeah, it's interesting when even your doctors don't know. Like my EP, he had never done that before. He's like, I have no idea. You can go ask people, but I don't know. Like, there's no literature to support what will happen. So just, yeah, being your own advocate, researching, even doing things like getting on random website forums and asking people just help. So
Thank you, Mary. I'm so glad that you were successful with that. So I also have long QT, and I have the 4 kids, and I was told the same thing with my oldest son, that I could not breastfeed due to the beta blockers, and that ended up being incorrect. But by the time I found that out, it was too late to start breastfeeding him. And so that's still something that bothers me. So I hope that everybody will advocate for themselves in all of those different ways, whether it's a pregnancy plan that's really important to you, or the breastfeeding. There's just so many different aspects of being a mom, and um, advocating for yourself from the very beginning during pregnancies is also great practice for advocating for your kids later on, especially if they end up having SADS conditions. So thank you for each of you for your great examples about that. Did each of you go into your pregnancy or somewhere along the line with a birth plan in place, or what did that look like between your OB and your cardiology team?
I'll go real quick.
Thanks.
Where I had been asymptomatic, there wasn't a huge concern. Like I said, postpartum was where I was most at risk, but once I had the C-section and where his heart rate was dropping, that's when it was decided that, maybe this is best for us. But other than that, we didn't have anything like, oh, I need to do it like this or that. It was just do my regular checks. And after my first pregnancy, though, we did start doing, where he did measure so small, we did do more ultrasounds with my other pregnancies just to check on their size, because they were all very small. But that's the only thing that I would say is really that went with the plan, was just more checks along the way.
Thanks, Tia.
For my birth plan, I asked my OB. I didn't talk to my cardiologist. He had not really been involved with much of my pregnancies just because I was asymptomatic. I never had any episodes during my pregnancies. And so I talked to my OB. I was like, I have an ICD. What's the plan? And he's like, well, the only thing we really need to do is make sure people know that you have an ICD, and then during an emergency C-section, they would put a magnet over it to turn it off for a while. Um, but that was basically it. The rest of my birth plan was just up to me, and like the emergency C-section I'd already had, and wanting a VBAC and that sort of thing. It didn't have anything really to do with my heart condition or my meds or the ICD.
Thank you, Mary. Go ahead, Madi.
So we had an original plan, which was they wanted me to probably be induced because I was so symptomatic and to try to give birth naturally. This is where you should probably advocate for yourself. My family kept telling me to tell the doctor no, even though she was a high risk fetal medicine doctor and worked with a lot of patients with high risk issues. I was the first ARVC heart failure patient she ever had. So she didn't really understand ARVC, as most doctors do not understand it, including my heart failure doctor. So it was only the EP that I had been with since I was 16 who really understood that, dancing, walking, playing softball, any type of physical activity led to me being shocked. So he's the one who really advocated by sending a very strong letter to the entire team saying, hey, you're going to kill her if you have her deliver. Like, his biggest concern was the baby getting stuck coming out, me coding, and then they couldn't get the baby up because I could no longer push. And so when he told me that, it was kind of traumatic to take in because I was like, wow, I didn't even realize that was like an option. I've never had children, didn't know that much about it. So that's when they changed me to a scheduled C-section. And then of course I went into spontaneous labor, but being on blood thinners, being in heart failure, having an ICD, having an arrhythmia condition, it was a perfect storm for things to go wrong. And so I think having an EP that knows you well, who can get the other doctors at play, the heart failure and the OB high risk doctor to understand your actual condition, if you are as high risk as I was at the moment, is essential for a successful outcome. I do not think I would have had a successful outcome if several things did not play out well that last week of my pregnancy. And I'm just really, it was not what I wanted, but I was just grateful that we both survived. At the end of the day, that's the ultimate goal. And sometimes that's hard. I had a lot of postpartum depression. Like I said, I was away from her for over 24 hours before I even got to see her. And so you just have to accept that when you do have a high risk condition, that your birth plan may not go the way you want. And it's so hard to accept, but it will get better. And like I said, I was lucky enough to go home. We both went home and we were able to recover. But the actual birth plan, it was just crazy because even though some of these doctors have been my doctors for a long time, like my heart failure doctor, they did not even understand what we were doing. And it took a third doctor to come in. So sometimes you really need a complex team to get everyone on the same page. But I should have advocated for myself better. Like I said, I couldn't walk without a walker. And so it's like, I should have been able to speak up, but the OB kept telling me that it was safer for me to try to deliver naturally when it wasn't. So I just want to reiterate that it's important to listen to your own body. Like, yourself better than any doctor who looks at your chart ever will. And when it comes to something as high risk as something like this, you really, really got to speak up for yourself and not be afraid of the pushback you may get.
Thanks, Maudie. I think that really also illustrates the importance of having, like you said, an EP that knows you and that knows your condition to advise you about what you should be doing to keep yourself healthy and so that you can have a healthy baby. And ARVC is so much different than the other SADS conditions, with it being a cardiomyopathy. And I can see definitely the importance of needing that heart failure team for you and your condition in that high risk monitoring because of the heart failure. And then sometimes with the other SADS conditions like long QT or CPVT, the doctors go to the other extreme when we really don't need that higher level of care, when we're asymptomatic and things, and still being pushed toward that higher level of care. So being able to advocate for yourself, either way, which one is right for you and your condition. Thank you. This has been an amazing conversation. You guys are wonderful, and it's so great to see a little snapshot of your journey to motherhood. Do you have anything else that you would like to add that we didn't go over? Any advice or things that you would tell moms or moms to be?
I think the only advice I would have is if you are symptomatic, even if you are already in heart failure, it's not impossible, but it is very challenging. And it is important that you live near the hospital in which you will be delivering and the doctors, just for the overall best outcome. And if you are in an advanced state of disease, it is essential you also have help lined up afterwards. Any mother will tell you that it's really hard in the beginning, no sleep, feeding every 4 hours, trying to breastfeed, all the things. It's even more difficult if you're also dealing with your own severe illness, most likely heart failure. I think if I would have only had ARVC, it would have been a much smoother time. But my goal is to also encourage people that just because you do have heart failure doesn't mean you can't still achieve your dream of motherhood, even though it might be more challenging.
Thank you, Maudie. Mary or Tia, do you have anything that you would like to add?
That was well said.
Genevieve, this is Gwen. Can I mention something? I joined in late. I'm a nurse with the Congenital Heart Center at University of Michigan. But I also have a husband, 3 daughters, and 5 grandchildren with long QT. And one thing that we did notice was even with a great care team, and it wasn't at University of Michigan, but and with maternal fetal medicine, cardiology, and everybody involved, when one of my daughters was admitted for her induction, the routine OB orders, admission orders, were automatically put in place. And there are some medications that would not be favorable for somebody with long QT. So just another plea for advocating for yourself, and don't hesitate to ask what kind of medications are ordered in case you have pain or nausea or whatever else.
Thank you so much, Gwen, for bringing that up. I really appreciate you doing that. And I think you're right. That's a big part of knowing your condition, knowing medications that are safe for you to take or not, especially with long QT and Brugada syndrome. Tia, did you have something you would like to add?
I was just going to say yes to that. That is so true. Even like with C-sections, they give you something to help ease your stomach and coat the walls, and it's something that's on the list. So become familiar with the credible meds. Become aware of that, and like you said, study it almost before you do have any type of surgery or any. I mean, it's good to know all around, but especially when you are going to be giving birth and maybe dealing with extra pain and nausea and whatnot. I think that's a great point.
We've kind of gotten accustomed to printing out the credible meds list before we go in so that they can put it right in the chart, not just for childbirth, but for other things too.
Awesome.
Hi, Gwendolyn. My name is Amber. I would like to connect with you offline potentially after this. I actually manage the radiology department at University of Michigan Health West. But I don't know if we've hit the Q&A session, but I actually do have some questions probably geared more toward Tia and potentially Mary as well, if this is the time set aside for that.
That would be great. I think we're ready to do that. Thanks, Amber.
Yeah, absolutely. So I actually have LQTS type 2 as well, Tia. And I was really happy to hear that you've never had a heart event, no SICD or no ICD in place or anything. Yeah. That's very fortunate. My husband and I are actually in Chicago now for a egg retrieval tomorrow morning. So all of the things you said about the hormonal changes and how that increases risk with our specific type really struck home with me because I've been being watched very, very closely because of that. 2 questions for you. The first is, did you experience any concerns or issues from maternal fetal medicine or from your cardiology team about the beta blocker that you were on during pregnancy, and did they switch it? Did you have any issues with that? And then also, did you experience any increase in symptoms or arrhythmias in your postpartum phase?
Yeah, okay. So they increased my meds. My meds were already, my beta blocker that I was on was Nadolol, and they said that was the best one to be on. And they did increase it postpartum for the first 6 months, or was it 9 months? I think it was between 6 to 9 months, because every time I would go follow up with my cardiologist, she'd say, all right, you're 1 month closer to being in the safe zone. Because the first 6 to 9 months, yeah, is when you are most at risk with the hormones and postpartum. And so that's the only thing that we really did. My first child, my cardiologist was a little more like, we got to keep an eye on you. But I did so well that she was like, oh, all right, we can back off with your other pregnancies. But yeah, postpartum is, when she definitely checked on me more and just increased my dosage, but I did not have any increased arrhythmias or any symptoms. I got a lot of anxiety. I think that was just the postpartum in general. I don't think that was related to the meds or anything. So I would say no symptoms aside from being just regular postpartum. And I did great with the increase of my meds. And then once I hit that safe point, they just put me back to my regular dose. So I hope that answers it.
No, that's really helpful. Thank you. And I'm glad to hear that you didn't have a lot of issues because, it's such a tight-knit community in the LQTS. You join all these groups and there's only so many people that have even our specific subtype. So you get to talking with people. And, you go from hearing stories like yours where it's like you were anxious and worried and then ended up not needing to be worried for anything to people thinking it would all be fine and they end up having a heart event. So I'm glad to hear that you didn't have a lot of complications. That's a good thing.
Yes.
I know that my cardiologist has talked about switching my beta blocker, and it's something my husband has been a little concerned about just because I've been so stable on it for so many years, which I guess leads me into my question that I had for Mary. I have an SICD in place, and there has not been a lot of discussion about how they plan on adjusting that, if at all, during a labor. We're very fortunate to be in a really high-end healthcare system for our care. But I know there's been discussions of, maybe Boston Scientific can come turn it off. They use a magnet to deactivate it for a while in some circumstances. I'm curious, with your extensive history, Mary, if there was any discussion about deactivating your defibrillator during your labors, or if they purely just wanted to keep it up and active the whole time.
We did have a little bit of a discussion. The only time they said that they would deactivate it is in case of an emergency C-section. Something with the tools that they use to cut could interfere with it. And so that in that case, they would place a magnet over it to turn it off. But as for labor itself, I was asymptomatic my whole pregnancy. So they weren't really concerned as if it would shock me or pace me or anything to that effect. But for the medications, it's interesting that Tia, your doctor said to stay on Nadolol, because mine asked me to stay on Metoprolol. He said that was the safest, because I did ask, do I switch? And he said, no, stay on that. And so I was on Metoprolol for 3 of my pregnancies. In one of them, they did ask me to increase it because I was on a very low dose. So I doubled my dose and I got into my second trimester. And there's something to do with second trimesters. It's when your blood flow is the highest. So your body is creating the placenta and your blood flow increases by, I think, 30%. So there's just a lot going on. Your heart's working really hard. And my blood pressure kept dropping. Every morning I'd wake up and I'd have super low blood pressure. And obviously a beta blocker is going to make that even lower. So I ended up, for that reason, going back to my original dose because I wasn't having any arrhythmias. And I would rather, not have to deal with the blood pressure issues. So that was the only thing with my meds and the ICD that I talked to my doctor about.
No, that's really good information actually, because I'm on Nadolol, and the information I was given specifically because I do want to breastfeed, hopefully, is that they were thinking about switching me to propranolol. But with my specific type of heart condition, and I'm sure Tia's familiar with this too, Nadolol is like the gold standard one for it. So, you know, I don't think there's a perfect answer out there for everybody, and I think it's individual, but I was genuinely just curious on other experiences.
And I think it was last year we had a pregnancy webinar where we had some experts in pregnancy and in SADS conditions come and talk about the like what beta blockers you should be on or stay on. And they did recommend that for long QT. And then Dr. Ackerman has also said the same about being on the most effective beta blocker for your condition and how important that is. So like with long QT being on Nadolol or propranolol, because they're so effective, and how they keep you safe so that you can have a healthy baby. And so that is good, Amber, that if they would change at all about talking about the propranolol and not a different beta blocker, because that, like you said, Nadolol is definitely the gold standard for long QTs.
So which beta blockers pass through the mother's milk to the baby and which ones do not?
That's a good question, Barbara, and we can put some information up on the website about it. But Dr. Ackerman has said that the Nadolol is safe to take during pregnancy and the postpartum period with breastfeeding. So, but we can definitely put information up on that. And I did breastfeed on the Nadolol with my kids after I learned from the correct doctor that that was safe to do so.
Because my concern would be is if the Nadolol passes through to the baby, and like I had children that were both positive and with long QT1 and those that weren't, and those that were, they would be on their own beta blocker. So then if that passes through, my concern is you're giving them double, or you're giving it to a baby that doesn't have a problem. So I'll look for what you put up.
And I think that most of them do pass through to some degree. And that's why I think it's important, as you said, you've had babies both with and without long QT, that it's important to see how they tolerate things in those first weeks, because they will be getting some of the medication.
And afterward, that's kind of what my doctors watched for. So I had the 3 that were positive for long QT and 1 that was not. And obviously I still was on my Nadolol with her, even though she didn't need it, it did not affect her heart rate or anything like that. And then my other kids that were on the beta blocker, and I was on the beta blocker on top of that, so they received a little extra. It also did not cause any issues with them, but it was something that my team, as well as their EPs, were aware of and could keep an eye on. Tia, did you have anything to add on that with your experience?
Oh, sorry. Yeah, I was just going to say, I've asked this question many times. I think we've all heard different answers. We've all wondered about it. And I know maternal fetal medicine they have told me, like, yes, it's going to transfer to the baby, but no one really knows for sure how much it goes, but it's not enough to like change anything. So that's all I was just going to say, that, yeah, it just like what the others have said, it does pass through, but it's not enough to change anything for the better or for the worse. And that, yeah, I nursed all of my babies with Nadolol as well. And yeah, so it's an interesting topic. Wish there was more information.
Thank you, Tia. Are there any more questions that anyone would like to ask?
I just have to note that I think for those of us that have families with long QT, it's pretty interesting how predominantly the children did get it, even though it's supposed to be a 50-50 chance. That's like, how does that work? But
that is very interesting. And as I was looking at the photos of Tia and Mary and Maudie, and then of myself, almost all of our kids have it. So the different SADS conditions. So we definitely, the genetics don't work out until you have a lot of kids. So okay, perfect. If there are no more questions, we just want to thank you all for coming tonight, and especially thank you to Tia and Mary and Maudie as our special guests for sharing your stories tonight. Here in a few days, the recording will be sent out to those who registered, so you can feel free to watch the recording. And we very much appreciate everyone attending tonight. Thank you.